Section we're going to look at is going to look at injuries to the thorax. When we look at the thorax, it's also referred to as a thoracic cavity. It includes the sternum, ribs, thoracic vertebrae, and diaphragm. This really creates the borders of the thoracic cavity. It also includes in the middle circulatory and respiratory system structures such as the heart, larger blood vessels, trachea, bronchi, lungs, and nerves, as well as the esophagus and thymus. The first section we're going to look at is the ribs. The ribs give the thoracic cavity the shape of that barrel-chested look, and they really protect the heart. There are 12 pairs of ribs, as well as the costal cartilage, sternum, and spine. Now, these can be very prone to fractures, and what we typically see is the 5th through the 9th ribs being the most prone for fractures. These are because they are rigidly secured to the rib cage, such as the sternum and the spine. So they're very sturdy. They have no room to move, and having a traumatic direct blow, such as you see with the mechanism of injury from contact sports or falling or from motor vehicle accidents, can cause these to become injured because there's nowhere for them to move. It can also be caused by repetitive twisting motions of the torso or very, very large coughing spells. You can see here in this picture, looking at the arrows, these are where the fracture sites, if you look very closely, you can see those fracture sites of the ribs. Signs and symptoms that we see, athlete has a lot of pain on inspiration, which is breathing in or taking very deep breaths in. The rib is point tender where the fracture is, and they may experience some sort of crepitus or that creaking kind of crunchy feeling upon palpations as those bone ends rub together. When we look at treatment, what we want to do is treat really the symptoms and the signs. We want to give them ice packs and non-steroidal anti-inflammatories, so to decrease the athlete's pain as much as possible. We want to prescribe them rest and make sure that they have as much support in the area as possible. Now, if the signs and symptoms don't decrease over a period of time, we need to refer them to the physician or the emergency room for further evaluation. Previously, treatment for fractures of the rib included a compression wrap around the rib cage, and according to the Mayo Clinic, these are no longer used for rib fractures because it can hinder breathing, which can increase the rate of an athlete acquiring pneumonia. So what the premise was before with the ACE wrap or elastic bandage is to compress the area to provide support and to not let the lungs expand as much. As the lungs expand with inspiration, they place pressure on the bones, which causes increased pain. Now, because we've seen increased cases of pneumonia when we have these compression wraps on because they hinder breathing, it's no longer suggested that we use them. For prevention, we need to make sure they have strong bones, be aware of what they're doing in the surroundings in their activities, and they can wear rib protective devices as well, depending on their sport. Next, we have costochondral separation. Costochondral separation occurs when the costal cartilage, and this is the part where the ribs attach to the sternum. And what we see here is what people typically call a separated rib. So the rib separates away from the sternum at this costochondral junction. And usually this is caused by a direct blow to the lateral rib cage, kind of squeezing those ribs in and pushing that rib away from the costochondral cartilage. We can also have a direct anterior blow to the costochondral area or to the sternum area. Signs and symptoms we see, they can have varying degrees of pain depending on how bad the separation is. Again, like rib fractures, they're going to have pain with deep breathing, point tenderness, and crepitus. They can also have some ecchymosis and localized swelling in the area due to the impact site. When we look at care for costochondral separations, we want to rest the injured area by applying ice bags and see if there's any decrease in symptoms. If the athlete or individual has any difficulty breathing at all, or they are go into severe pain, we need to call 911 and have them transported, because this could be a rib fracture, not just a costochondral separation. For prevention, it's the same thing as we see for rib fractures. So protect the area, make sure we have strong bones. For contusions, like any other contusion across the body, due to a direct blow to the rib cage, sometimes rib contusions may be mistaken for a rib fracture because they have a lot of the same signs and symptoms as a rib fracture, as well as a costochondral separation as well. So that person will be have pain, swelling, ecchymosis, point tender in the area. But the one thing that we don't see is crepitus in a contusion. And typically what we want to do is kind of hang our hat on if they have crepitus or not have crepitus to determine if it is a contusion or a fracture. When we look at treatment, we want to apply ice, rest from the activity, take non-steroidal anti-inflammatories. But if the athlete has any problems breathing or is having a significant amount of pain, then we need to call EMS as soon as possible. For prevention, we can wear protective rib equipment. As you can see here, that this is just a kind of an ACE wrap for the rib area that helps support it. But we want to make sure that we wear protective equipment during activities. Moving on to the lungs, what we see here in the lungs is that there's a lot of internal injuries that can occur that can be life-threatening as well. So let's take a look at the lungs in this section. The first injury that we see is a pneumothorax, and this is what people typically call a collapsed lung. So if you look at that first picture, you can see it identified. It's a collapsed lung on the left-hand side and a full lung on the opposite side, as well as if we look at the x-ray picture, we can see a nice dark area, and then we can see a light area on the other side. That is where we would say that there is a problem on that right hand side. But when we see a pneumothorax or a collapsed lung, the air collects around the lung in the pleural cavity, which the pleural cavity is the space that surrounds the lung in the thoracic cavity. And this air causes improper lung functioning, and we can't take in the normal amount of air per breath. So when we look at mechanisms, we see that that there is some sort of puncture to the area, possibly due to a rib being fractured or an outside implement such as an arrow, a gunshot wound, or a knife. Sometimes these lungs can even spontaneously collapse, and air in the lungs escapes and enters into the pleural cavity, and this is what we refer to as spontaneous pneumothorax. And typically when we see a spontaneous pneumothorax, there's a pre-existing condition such as COPD or asthma that can be causing this. When we look at signs and symptoms, that individual has shortness of breath, pain when breathing, they have chest tightness, and they are lightheadedness because they're trying to breathe very rapidly, very quickly, which decreases or increases the chance of lightheadedness or syncope. Athlete's heart rate is rapid and the blood pressure is low. And as this goes on, due to this low blood pressure, the athlete can be cyanotic after a while. So if we do, and if we're trained to listen to lung sounds, when we do listen to the injured side, there will not be a sound. You will not be able to hear the air going into the lungs and out because the lung has collapsed and there's no air getting into it at that time. For treatment, this is what we refer to as a medical emergency. So we're going to treat them by calling 911. Monitor the athlete's airway, breathing, and circulation, and if needed, treat them for shock. Sometimes we can have a lot of tension, and it can lead to further injury, so we want to make sure we call 911 immediately for treatment. Prevention, like I said before with the first couple parts about the ribs, we can wear protective rib cage equipment. Athletes should not smoke, as well as controlling their asthma as best as possible. So you can see there in some pictures that these are typical rib protectors. The bottom one that says Douglas on the back, this is what we call a flak jacket, and an extension of a football pads for football, so it can extend onto the rib area to protect all the ribs. And typically we see running backs wear these as well as quarterbacks. Next, we have a hemothorax. A hemothorax is very similar to a normal thorax in regard to mechanism, signs, and symptoms. But a hemothorax is when the pleural space fills with blood instead of air. And we see that same mechanism. We have a blunt trauma from an object to the area, and this area penetrates the lung and results in a hemorrhage. And the hemorrhage then causes blood to fill the pleural cavity. And when we see individuals that may be predisposed, they may have tuberculosis, lung cancer, or some sort of other previous lung condition or surgery that predisposes them for a hemothorax. Signs and symptoms, like I said, they're going to be very similar to a normal thorax. So make sure that we're going to also treat them the same. We're going to call EMS immediately, treat them for shock if needed, and monitor their ABCs until EMS gets there. Again, we're going to wear chest protective equipment for prevention. One that's not discussed in the book is a pneumothorax, and this is kind of a combination of both of the hemothorax and pneumothorax types of injuries. And the difference, everything's the same. The difference is that the blood in the area will be lighter in color and kind of frothy because what's happening, so if they cough up any blood, it'll have a frothy appearance because that blood is being mixed with the oxygen in the lungs, and it can cause that lighter, bubbly type of blood substance. Moving on, we have asthma, and I'm sure that everybody knows about asthma, what asthma is, but asthma can be a very life-threatening condition which occurs when the respiratory tract airways become inflamed, and the airways become swollen and decreased in size because there's some sort of allergen or some sort of trigger, and it causes a lot of difficulty in breathing for that person. So we look at mechanism. There's an allergen or some sort of trigger in the environment, such as pet dander, pollen, dust, etc. But it can also be caused by stress, emotions, environmental changes, cold weather, which decreases the size of the airways, as well as exercise for exercise-induced asthma. Signs and symptoms, we see someone with shortness of breath. They can't catch their breath. They have wheezing as the airways are constricted, that we get that wheezing sound. They have anxiety because they can't get enough air in. They may be coughing, chest tightness, and a rapid pulse. Treatment, we want to make sure we try to remove the trigger. If we can't remove the trigger, then we want to remove the person from that trigger, whatever way is safer. We want to make sure if they have a rescue inhaler, help them administer it. If not, we want to make sure that we have them sit in a comfortable position, taking slow, controlled breaths, and depending on the situation, we may have to call 911 or EMS if the condition does not get better, as well as if they have some sort of decrease in airway, breathing, or circulation at any point in time. As well, when we're waiting for EMS, we want to make sure that we treat for shock and continue to monitor that individual. When we look at prevention, prevention is not always possible because they may be born with this type of allergen or allergic reaction. But when we look at preventing these exacerbations or increased causes of it, asthmatic athletes should always make sure that they have their rescue inhaler with them at all times. And we want to make sure we try to avoid or have them avoid asthma triggers as much as possible, whatever that trigger may be. This next part to the thorax is going to look at the heart and the internal organs in the thoracic area. So the first injury we're going to look at is sudden cardiac death syndrome, or SCD. And this is when an athlete dies unexpectedly from cardiac arrest, and they may, unfortunately, may or may not experience any signs and symptoms of illness. And this is what we see when somebody just falls out for no apparent reason. But we know that some of the mechanisms that underlie sudden cardiac death is caused by some sort of cardiac disease or illness that's already there, such as hypertrophic cardiomyopathy, arteriosclerosis, viral myocarditis, maybe an aortic valve stenosis or narrowing of that aortic valve, maybe drug-induced electrolyte imbalance. But there is something going on within the heart structure that's going to cause this sudden cardiac death syndrome. And like I said, you may not see signs and symptoms before, and they may just have this predisposing condition that leads to this sudden syndrome. Signs and symptoms, if they do exist or present themselves: chest pain, difficulty breathing, confusion, sweaty skin, and unsteadiness. This is right before they have their cardiac arrest. And the athlete then loses consciousness, stops breathing, and has no pulse. So, like you guessed, this is an emergency. We have to call 911 immediately and check the athlete's ABCs. After we do that, we want to start CPR as fast as possible and use an AED to resume a normal heartbeat. And after we call EMS, we're going to perform CPR and use an AED until EMS arrives. So make sure that we don't stop that CPR. Prevention, we really can't entirely prevent sudden cardiac death syndrome, but we want to make sure that we know the person's history and the underlying risk factors that they do have. Last but not least, we have commotio cordis. Commotio cordis is another traumatic injury that can occur in the athletic population, and this is sudden death due to disruption in the heart's electrical conductivity, and they may or may not have an underlying cardiac issue at all. Really what happens is that an athlete is struck by an object or a person or something in the heart area, and what happens is that this really disrupts the electrical conductivity of the heart, so it causes the beat to be thrown off of the heart. When we look at signs and symptoms, they will go unconscious, they won't be breathing, they won't have a pulse, they may become cyanotic, and ecchymosis appears or bruising appears at that spot of impact. For treatment, it is a medical emergency. We're going to call 911 immediately, check ABCs, and then immediately start CPR. The faster that we can start CPR and use an AED, the better chance that that person will survive. Prevention, we're properly fitted chest protective equipment. Now, even though that is a way of preventing, protective equipment is not foolproof, so we still see hockey players, we still see football players, we still see maybe catchers in baseball still suffer from commotio cordis or this disruption because that the force behind that implement is so strong that it still disrupts the heart's rhythm. Also, we need to make sure that the athlete is aware of their surroundings just in case maybe they can avoid an injury from occurring.